The Boehringer Ingelheim India Diabetes team is dedicated to provide value through innovation to doctors and patients.
As Sun Tzu said, every battle is won before it is fought. We in Diabetes View hold to this principle strongly and prepare today for our tomorrow.
Challenges which pushed us out of our comfort zone this year. Expand the usage and differentiate Empire. Distinct positioning for Glixambi and Jardiance met. Low price point launches of competition in SGLT2 inhibitor market. Establishing Trajenta's simplicity. These challenges led us to prioritize our goals to establish undisputed leadership of Jardiance. Distinctly position Glixambi and Jardiance met without cannibalization. Make Trajenta the number one. Boehringer Ingelheim's endeavor is to become the number one MNC in the patented non-insulin market. Even in ambiguous circumstances, we displayed accountability and demonstrated ownership for our decisions and actions. We in Jardiance accelerated the belief that standard of care has advanced in the management of T2DM by leveraging ADA EASD guidelines, which clearly classified treatment regime to be selected basis the ASCVD prevalence to more than 10,000 HCPs. Jardiance Met became the first SGLT2 brand to position in drug-naive T2DM patients with CAD, which is 30% patients in routine clinical practice. Glixambi, uniquely positioned versus Janamit and Galvus Met in patients uncontrolled on metformin. In Trajenta, we established the simplicity concept, strengthened with cardiovascular outcomes to 4,000 HCPs through multi-speciality webcasts, including international faculty and ad boards.
The guiding principle of karma says that intent and action influences the consequences. Here, every day, we try to maintain optimism in our intent and agility in our action. Agility to rethink, reinvent, and respond. That is our mantra.
Jardiance established its undisputed leadership by highlighting the robust data of EMPA-REG outcome and RWE studies to 7,500 HCPs within 3 months in a perfect display of agility. In our endeavor to make Trajenta number one, we displayed agility in full strength by maximizing ADA readout of Carolina to 500 HCPs within 2 hours.
Entrepreneurship is the only way to win in challenging markets like India. We, in the diabetes business, being the growth driver for BI, display this behavior day in and day out.
The Jardiance team disseminated early usage guidelines recommendation to 14,000 HCPs using innovative multi-channel marketing tactics, thereby positioning Jardiance early in the treatment paradigm. In Jardiance Met, we propagated early detection of CVD in T2DM patients through one-of-its-kind CV risk assessment clinics and CAD risk score to drive guidelines recommendations into clinical practice and touched 2,500 patients. To establish distinct positioning for Glixambi, we initiated a white paper document to educate physicians on the rationale and place of this combination in type 2 diabetes management. Trajenta marketing created innovative simplicity emotional AVs, capturing emotional aspect of patient needs in 1 minute, reaching to 7,500 build and defend HCPs.
Dr. APJ Abdul Kalam rightly said, if you want to shine like a sun, first burn like a sun. AAI behaviors at work help us shine brighter and take BI to newer horizons every day.
Jardiance is the number one mono OAD in IPM, beating Januvia. Jardiance regained 3% market share in 3 months despite launch of low-cost SGLT2. Jardiance Met gained highest prescription share in T2DM patients with CVD or high CV risk. Glixambi achieved market leadership within 7 months of its launch. Trajenta achieved leadership position in DPP4 inhibitor mono-patented market for the month of October, beating Januvia. And that's not all. Boehringer Ingelheim India ranks number 2, outpacing Novartis amongst MNCs in patented non-insulin market. By demonstrating Boehringer Ingelheim behaviors of agility, accountability and entrepreneurship, the Boehringer Ingelheim India Diabetes team has overcome the challenges and manifested the goals. From here, the graph will only go higher and higher.